The perfect Medicare reform both Republicans and Democrats will love. Socialism has unleashed tyranny, starvation, and mass murder on a scale never seen before in human history. Socialism was implemented in the Soviet Union, East Germany, Bulgaria, Hungary, Maoist China, Chavez Maduro's Venezuela, and other places. In every one of these places, it has failed. The United States is a mixed economy. Most goods and services, food, clothing, housing, and so on, are bought and sold in competitive markets. Prices are set by supply and demand. However, two of our most important industries, education and healthcare, are predominantly socialist. Prices are set by the government rather than by supply and demand. Seniors should be trusted to spend their own Medicare money. Medicare money should be paid to seniors in cash, like Social Security is paid, rather than having Medicare pay doctors, hospitals, and other providers. Congress should be convinced to allow at least one state to have its Medicare money paid to its seniors as a test and an example for other states. Milton Friedman recommended this idea of paying benefits in cash rather than services. Seniors spending their own Medicare money in free competitive markets would improve health and greatly reduce healthcare spending. Seniors could be paid $999 per month, and the cost to Medicare would be the same as Medicare's budget in 2022. If Medicare paid seniors $900 per month instead of $999, the cost of the Medicare program would be reduced by about 10%. With $900 per month, seniors would have more than enough money for a good catastrophic health insurance policy. A catastrophic health insurance policy for the entire year should cost under $1,800. Seniors, both Republicans and Democrats, would love this program. They would have much more money to spend on health care and on whatever else they wanted to spend it on. Seniors would spend their Medicare money much more effectively and much more carefully than the federal government spends Medicare money. Who sets prices for medical services? Milton Friedman was against government setting up bureaucracies to regulate industries. He said the regulated industry would inevitably take over the bureaucracy and use the power of the bureaucracy to harm competitors and consumers. This is what's happened to Medicare. Doctors took over the Medicare program and appointed their lobbying group, the American Medical Association, to set the values for all the services that doctors provide. Medicare then used these values to create the Medicare Physician Fee Schedule. The Medicare Physician Fee Schedule is a price list of over 10,000 services that doctors provide. The Medicare Physician Fee Schedule is highly influential. It is used not only by Medicare, but also by Medicaid, TRICARE, and most importantly, 80% of private health insurance companies in the United States. To keep the Medicare Physician Fee Schedule updated, the American Medical Association created a group of doctors called the Relative Value Update Committee, or RUC for short. The RUC consists of 32 doctors who meet 3 times a year to debate and agree on the relative values of all the medical services that doctors provide. According to an article in the Washington Post, A little-known committee of doctors help establish the value of every procedure in medicine. Critics say the American Medical Association, doctors' chief lobbying group, is the wrong organization to do the work. According to an article in Time magazine, the RUC contributes massively to the illogical and inflated way that healthcare prices are set. When governments set prices, terrible unintended consequences result. Thomas DiLorenzo in The Problem with Socialism writes, "The free market pricing system is indispensable as a tool of any functioning economy. Government-mandated prices produce nothing but chaos. Without market prices, rational decision-making is impossible." One tragic unintended consequence of allowing prices for medical services to be set politically by the government is that millions of unneeded operations have been performed. The Medicare physician fee schedule encourages doctors to recommend procedures like heart stents and to ignore alternatives like the Ornish program. The first heart stent was implanted in a human in 1986. A study in 1997 found that heart stents in people with stable heart disease, not people having a heart attack, do not prevent heart attacks or extend life. Large studies in 2007 and in 2020 came to the same conclusion. Did Medicare eliminate the financial incentives of hospitals and doctors to use stents based on the 1997, 2007, and 2020 studies? No. With prices set politically rather than by supply and demand, Medicare and the AMA continue to incentivize unneeded stent operations. As a result, millions of unneeded stents have been implanted. Prices vary based on a variety of factors, but Medicare typically pays around $11,000 for a heart stent operation, $10,000 to the hospital, and $1,000 to the cardiologist. According to an article in the New York Times, in many hospitals the cardiac service line generates 40% of the total hospital revenue. So there's incredible pressure to do more procedures. When you put in a stent, everyone is happy. The hospital is making more money, the doctor is making more money, everybody is happier except the healthcare system as a whole, which is paying more money for no better results. Dr. Dean Ornish, founder of the Ornish program, writes, "The vast majority of stents and angioplasties have been performed in stable patients who do not usually benefit. If Medicare money were paid to seniors instead of providers, far fewer unneeded heart stents would be used." In competitive markets, prices fall when services become easier to perform. This is not always true when prices are set by the government. Government-set prices are often inflexible. According to an article in the Wall Street Journal, the Medicare payment for placing cardiac stents stems from a 1994 analysis. Stenting today requires around 45 minutes. The AMA's valuation suggests a 2-hour procedure. The laws of informed consent require cardiologists to advise patients of the limitations of stents and of alternatives to stents, such as the Ornish program. Studies have found that cardiologists often fail to fully inform their patients. As a result, people with stents may walk out of the hospital thinking they've been cured. They don't realize that stents do not stop the progression of heart disease. Only diet has been proven effective at reversing plaque. Dr. Joel Fuhrman in The End of Heart Disease rights concerning heart stents and coronary artery bypass grafts. Certainly these modern medical technologies, surgical techniques, billions of dollars of procedures, and hospital real estate would not exist unless they were useful and would extend your life, right? These procedures have to work, or your doctor would not be insisting on them, right? Wrong, on both counts. A careful review of medical studies on this issue demonstrates that even if you have advanced cardiovascular disease, these procedures likely shorten your life, not lengthen it. According to the CDC, 85% of U.S. healthcare spending is for chronic diseases, such as heart disease, cancer, diabetes, and dementia. When a senior suspects a chronic disease like heart disease, the first choice for treatment is often their doctor. This makes financial sense because Medicare is paying most of the bill. When a doctor first diagnoses a chronic disease, this is a critical point for the patient and for the healthcare system. If the underlying cause of a chronic disease is not treated, many expensive procedures may result, such as angiograms, stents, pacemakers, bypass grafts, and so on. Unfortunately, the Medicare physician fee schedule incentivizes doctors to recommend drugs that treat only symptoms and to ignore treatments that cure chronic diseases, such as the Ornish program. Dr. Dean Ornish worked for 16 years to get Medicare to pay for his Ornish program. The program is now available in many U.S. cities. The program has been proven to reverse plaque in coronary arteries and to protect people from many chronic diseases. Visit Ornish.com for details. The Ornish program would seem the obvious choice, especially for heart patients who qualify for Medicare coverage. Unfortunately, Medicare pays doctors based on the quantity of services performed, not the quality. The Ornish program might cure the patient and prevent $1 million of future spending, but the doctor will be paid the same fee as an evaluation that prescribes only drugs, and might never see their patient again. On the other hand, if drugs are prescribed, the doctor will be rewarded with follow-up visits, tests, and procedures. The fee schedule incentivizes doctors to build busy, long-term practices by prescribing drugs. Thomas Edison predicted that the doctor of the future would give no medicine, but would interest patients in diet and in the cure and prevention of disease. Edison was wrong. He failed to foresee that competitive prices for medical services would be replaced by political prices set by the federal government and the American Medical Association. The Medicare physician fee schedule has been a disaster for America's health. It's also been a disaster for the national debt. The national debt is increasing at an alarming rate, from $6 trillion in 2000 to over $31 trillion in 2023. Just the annual interest on the debt is $400 billion. Per capita healthcare spending in the United States is over $12,000 versus an average of less than $6,000 in 12 other wealthy countries: Germany, Switzerland, Austria, Sweden, the Netherlands, Canada, Australia, France, the United Kingdom, Belgium, Japan, and South Korea, and versus just $816 in China. Why? What accounts for this amazing difference? There are two reasons. First, the United States is one of the few countries that uses a fee-for-service model, that encourages doctors to perform as many services as possible. Second, the Medicare physician fee schedule pays doctors illogical and inflated fees based on values set by the doctors' lobby, the American Medical Association. Doctors' incomes should be based on market competition, not on government-set salaries or fees. Doctors in France, Germany, Italy, and Japan are paid government salaries of about $120,000. U.S. doctors, paid based on government-set fees, make much more. Family doctors average $232,000. Gastroenterologists, $406,000. Interventional cardiologists, $450,000. According to an article in the Weekly Standard, the debt disaster we confront in the coming years is a function of an explosion of health entitlement costs and especially Medicare costs. The program's current trajectory would swallow up the federal budget, and taxes could not be raised high enough fast enough to keep up with its growth without crushing the economy. Market competition creates knowledge, improves quality, and lowers prices. If prices were set by a competitive free market, the incentives of doctors and patients would be fundamentally changed. Government-set prices have never worked. They were tried for decades in the Soviet Union, China, and many other countries with disastrous results. They're biased and inflexible. They eliminate competition and stifle innovation. How would seniors spend Medicare money? Seniors would investigate low-cost alternatives such as the internet and books. Some books that provide practical ways to reverse chronic diseases include How Not to Die by Dr. Michael Greger, Prevent and Reverse Heart Disease by Dr. Caldwell Esselstyn, and The End of Heart Disease and the End of Diabetes by Dr. Joel Fuhrman. Seniors would consider alternative solutions, such as counterpulsation therapy. A person lies on a table or bed with their legs wrapped in inflatable cuffs. The cuffs inflate and deflate in time with the patient's heartbeat. The therapy is effective for relieving angina and improving blood flow. However, it's difficult to find a doctor to prescribe it and difficult to get Medicare to pay for it. Seniors would consider alternative providers, such as dietitians, exercise coaches, acupuncturists, chiropractors, massage therapists, and yoga instructors. If surgery was needed, there are low-cost alternatives, such as the Surgery Center of Oklahoma and medical tourism. Many foreign countries offer surgery services at a fraction of the cost of U.S. hospitals. Seniors would spend Medicare money much more carefully and much more frugally than the government spends Medicare money. How carefully does Medicare spend Medicare money? Is Medicare a good steward of the taxpayers' money? No, it's definitely not. According to the GAO, the Government Accountability Office, due to its size, complexity, and susceptibility to mismanagement and improper payments, we first designated Medicare as a high-risk program in 1990. Unfortunately, Medicare has remained a high-risk program ever since. Every year, the GAO reports billions of dollars of fraudulent payments. Some of the fraud is so ridiculous it's hard to believe. According to an article in Forbes titled Medicare and Medicaid Fraud is Costing Taxpayers Billions, federal officials set up the Medicare Fraud Strike Force in 2007, which visited at random nearly 1,600 businesses in Miami, ground zero for Medicare fraud, that had billed Medicare for durable medical equipment. Officials found that nearly a third of the businesses, 481, didn't even exist, yet they had billed Medicare for $237 million over the previous year. One of the New York crime families has moved to Florida because defrauding Medicare is both more lucrative and less dangerous than some of the traditional organized crime activities. CMS, the Centers for Medicare and Medicaid Services, has over 6,200 employees. But even with all these employees, Medicare continues to pay fake bills without bothering to verify them. Medicaid is even worse. According to the GAO, Medicaid lost $85 billion to fraud in 2020, 13% of its budget. If Medicare money were paid to seniors rather than providers, fraud and overhead in the Medicare program would be drastically reduced. In summary, the Medicare physician fee schedule, number one, has caused millions of unnecessary medical procedures. Number two, has increased chronic disease by incentivizing doctors to treat symptoms rather than causes. And number three, has exploded the U.S. national debt. In addition, the Medicare and Medicaid programs suffer from amazing levels of criminal fraud. The solution is simple. We should trust seniors to spend their own Medicare money. Seniors would spend their Medicare money much more effectively, creatively, carefully, and frugally than the government spends Medicare money. Prices for medical services would be set by market competition instead of by a government bureaucracy. Seniors across the board, both Republicans and Democrats, would love this program. They would have much more money to spend on health care or whatever they wanted to spend it on. More money would go to diet and exercise programs and to prevention. The epidemics of obesity and diabetes would begin to be reversed. Fraud and overhead in the Medicare and Medicaid programs would be cut drastically. If Congress could be convinced to allow even just one state to pay Medicare money to its seniors, billions would be saved, health improved, and an example provided for other states. With seniors spending their own Medicare money, the question might one day be, how come healthcare spending in the United States is only half as much as in other wealthy countries, and yet our results are so much better?